Welcome to AC TV 20's Health Matters. I'm Dr. Erich Parks, and with me today is a really special guest. She's from Auburn, and she is a practicing doctor who will be talking to us about a subject that we all want to know more about, which is personalized medicine. So I'd like to introduce Heidi Hook, naturopathic doctor.
Thank you.
Heidi, welcome.
Thank you, and thank you for having me.
You're welcome.
So I'm Heidi Hook, and I'm a naturopathic doctor. I've been practicing for 18 years. Was born here in Auburn, California, and raised here. I went to University of Washington, where I got my undergraduate degree in psychology. And while at University of Washington, I was a rower, and I was exercising a lot, and I was not eating very well, and lots of stress, and I got chronic fatigue. So I went and saw a lot of different MDs or doctors to help me, and I couldn't get better. And so this is kind of my path of how I became a naturopathic doctor. I didn't know what a naturopathic doctor was, and a friend said, go see one, and I said, okay, and because I didn't have anything left to do. So I went and saw one, and I stopped getting worse and started getting better, and I think that's where I really realized that this is what I wanted to do. So I then went to Bastyr University and graduated with my degree in naturopathic medicine in '96.
Oh, in '96.
Yeah.
Just as an aside, I had, before deciding to go to chiropractic school, had decided I wanted to be a naturopath. And then I spoke to a doc, and he said, well, there's only 7 states where you can get a license at that time. And I went, oh. He says, you should check into chiropractic school. Right. And that's where my path sort of divided.
Right.
I was very interested in the field of naturopathic medicine. So, and that's the arena now, I think, that's taking the lead in personalized medicine, which is what you're specializing in.
Right.
Can you define a little bit about how would we look at personalized medicine? What is that versus medicine as we know it in the allopathic sense?
Right. So medicine as we know it looks at one disease that comes from one cause that has one treatment. And so personalized medicine we know that there's a multifactorial number of causes that cause each disease. So we look at age, we look at genetics, we look at nutritional status, we look at toxin exposure, we look at environmental exposure, we look at stress, we look at sleep or insomnia, we look at bacteria or viruses, we look at gut health, we look at hormones, we look at neurotransmitter imbalances. And as a naturopathic doctor, it's really about looking at somebody in that whole picture. So it's not just one cause, and I can't tell you how many people come in and they're resigned that this is what they have. And when we can look at just that bigger picture, it's kind of, to me, where medicine is going. Yeah. Making it fit each person, because we know that each person has a multifactorial reasons for why they're sick. Right. And I think of the naturopathic doctors as the specialists to getting people back to optimal health. Right. Not just manage the symptoms. Right.
So you're looking at the person with the disease rather than the disease that has the person.
Exactly. Yeah. Exactly.
Well, this is really an exciting field for me as well, because I realize that as our ability to diagnose and to test and to look into how we're all different, it truly is amazing how each person, even though they may have, you may have a room full of people with the same symptoms, you can have so many different things that are contributing to that person's ill health. So let's get into some of the things you were talking about. I'm really interested in the genetics. Yeah. I think this is a fascinating field. It's just blowing up now. But I sense, and you may feel the same way, that this has a great potential to be misused. So how would talk a little bit about genetics and how it's important that we understand that, and how it should be used correctly, and how we should be looking at that.
Right. So it is a super exciting time to be a doctor in this age, because the testing that's coming out is so much more comprehensive. What we can test is so much more comprehensive. But again, more information can be dangerous, or a little bit of information can be dangerous.
Right.
And this whole study of nutrigenomics or epigenetics, it's looking at how your nutritional status affects your genes and how your environment affects your gene expression or your genes. And so just backing up to what are your genes? Your genes are kind of the roadmap, your DNA, your RNA, and it's the roadmap that makes you, you.
Mm-hmm.
And your body has to replicate your body every day. It has to remake every cell every day. And so it has to read that genetic material. So I liken it to when you're young, right? Most of us are born, that's probably our healthiest time, when we're young and babies. And our DNA and our RNA is crisp and clean, and it's easy to read. I liken it to a cookbook. So if you have a cookbook and it's new, you can read the recipes, the pages are crisp and clean, they're easy to read, and you can make your cakes and they turn out well. And as you use that cookbook, as the decades go by, those pages get stained, ripped, torn. Maybe you can't read the recipe as well, and so this time when you're making that cake, you forget the salt or you forget the baking soda, so it doesn't come out as well. And that's the same thing with your genetic material. It may not be as crisp and clean, and so your body then can't make yourself optimally, and that really kind of then opens the door for disease to happen. Now, if you think about the way our body makes our body, it happens in every cell. Mm-hmm. And in every cell, there's this intricate pathway of enzymes and nutrients that have to get made. So I think of it as a freeway system. Right? You've got your freeways, your highways, your side streets, you have your stoplights, you have to have road maintenance, so you have to have healthy roads, stoplights at work, and the traffic can move through. And on a Sunday drive, the traffic can move through really easily. Right. Even if there's a pothole at the sides that they're not maintained, everybody can move through pretty quickly. On rush hour traffic, though, you need to have everything maintained. And so the difference between a Sunday drive and a rush hour traffic is the difference between a low stress and a high stress diet, or a bad diet versus an optimal diet. So it's our diet, it's our nutrition that kind of lays the foundation and builds the roads and the freeways and maintains them on a day-to-day basis. And so the diet and the nutrition is that foundational piece. Right. And if you do, you've got to keep that healthy. So if you you can manipulate the genetics, it's like turning on a green light when your roads aren't working. Oh. So you can end up with some difficulties.
So we're talking about gene expression there. That's one of the things I wanted to find out. You know, so many people, I think, believe that we're a slave to our genetics.
Right.
And so genetics being maybe the software system of our cells, do we have the ability to change the DNA, or do we just change the expression, or how would you characterize that?
That's a great question. So the DNA, there was a study done in 1990 where these scientists took some mice and they looked at one specific gene, and it was called the agouti gene. And this gene, when it was turned on, caused ravenous appetite, obesity, increased cancer risk, high cholesterol, and the rats were big and had yellow hair, yellow fur. And so they took those mice and they changed their diet made a specific and gave them some specific nutrients. And what they saw is that their offspring were perfectly normal, had a normal appetite, no high cholesterol, lived long, had dark fur, completely changed the expression of that healthy, and their DNA remained the same.
Oh,
so
same as the parent.
Same as a parent.
Oh,
it's just that they had different nutrients. So to me, I mean, that is, you are what you eat. And so it means that you have 70%, your ability to change your genetic material is 70%. I mean, you can change who you are, and whether your disease, you don't have to have those diseases that your family had.
Right.
I can't tell you, Eric, how many times patients come in and say, well, right, my dad had hypertension, high cholesterol, diabetes, and so I'm just destined to have it, so just manage it. That is not the case anymore. So that's not what we're seeing. And I think that is what's so exciting about this genetic information, is that it can really give us an understanding of who's going to go there and how we possibly can bypass it. Again, you have to have healthy streets and roads with a healthy diet to make that all possible, to even start talking about that genetic part.
Absolutely. We used to have a cartoon hanging up in my office. There was a family of obese people around a table that was stacked with donuts. And the father's reading a paper and says, look here, it says obesity is genetic. Well, the joke is, of course, it's familial. It's how they're all eating. It doesn't have to be that everybody is obese because genetically somebody in the family has been. The same way as you're suggesting, diabetes, high blood pressure, those types of things tend to have genetic predispositions, but we don't have to have those express unless we ignore, you know, the natural way of things, the way we should be eating, or our lifestyle activity. So that's real exciting, because to understand that, I think, empowers us a little bit more to say, oh, I have control. I can change things.
Right.
And so people like yourself can help guide the people to that. But in order to do that, I know there's tests out there. What's your experience with some of the genetic tests that are available, and what do you like to use for that?
So I'm going to put the genetic test as my second. I'm going to address the micronutrient panel, because again, the foundational piece is nutrition.
Right.
Just talking about hypertension, 70%, 60 to 70% of the people that had hypertension were able to have complete resolve of their high blood pressure when they repleted their deficient nutrients. That's huge. And so, and the same thing kind of across the board. So my favorite test, kind of hands down, is called a micronutrient panel. And what it does is it looks at a white blood cell, and it looks at the nutritional status of that white blood cell. So that tells me the last 4 to 6 months of your nutritional status. And if you remember that you eat the food, you absorb the nutrients into your blood, and then it takes energy to get those nutrients into the cell. And so when you do like a serum B12, you're just seeing the B12 that's in the serum. Some of that could be oxidized. We don't know how much is getting into the cell.
Right.
So this test tells me, again, last 4 to 6 months, and it looks at all the B vitamins, some amino acids, other vitamins and nutrients, but it gives me this foundational piece of how much of this is genetics and how much of this is just poor diet.
Right.
You know, and a lot of times we can look at it, and I can kind of see maybe some similarities where I can say, well, I think it could be this gene, and then we'll do the genes and we'll go, yeah, okay, it all fits. But sometimes it's purely just poor diet. Or they don't have a healthy gut, their absorption is low, their stress is high, so they're using up their nutrients really quickly and they can't stay on top of it. So there's so many different reasons of why, and again, that's that foundational piece.
Right.
So the testing, there is a genetic test that you can do to look at the genetic pieces, the genetic SNPs, or the genetic, you have your genes, and then you have the variants that can be kind of like in the freeway system. If you have a variant in this gene, it can actually turn on that enzymatic pathway to run faster, or it can turn off that enzymatic pathway to run slower. So if you think about rush hour traffic, and you've got one light always red and one light always green, you're going to have traffic. And so looking at somebody's genetic profile, I know big in the media right now is this whole MTHFR, methyl tetrahydrofolate reductase inhibitor. So it means that you're having a hard time converting your folate, which is from dark leafy greens, to the more active type of folate that your body can use.
Right.
When you eat a dark leafy green, it takes that has to go through 6 different enzymatic pathways to get it to be usable. So that's a lot, and 30 to 40% of the population can have that variant. So then they don't make their folate as well. Now, folate and B12 are kind of the backbone to your body making your body. And so looking at those possible genetic mutations or variants can give us a good idea of what specific nutrients you need.
Right, so if you found that that variant was there, you might surmise that if they had the symptoms that would correlate with low B12 or low folate, that they might need to take more than somebody else who doesn't have that variant.
Correct.
Yeah.
Or they may not be able to get it just from their diet.
Oh, yeah.
That's the other piece. And so there's more to say on that, but let me get back to the other testing to do.
Right.
Is the telomeres. That is also big. That's a big test that's out. So telomeres are the end pieces of your chromosome, and they have to be healthy to keep your chromosomes healthy so they can replicate. And as we age, it's a normal process for those tails of the chromosomes to get shorter. And as they get shorter, they're not as healthy. So, and there's things that you can do to shorten them quicker, like getting older, or having stress, or not having antioxidants in your diet, having saturated fats and trans fatty acids and all of those kinds of things. And there's things that you can do that lengthen them, that make them healthy, like good antioxidants, vitamin C, eating a healthy diet again. So those are the things that can lengthen those telomeres and actually make you younger.
Right.
So that's the test that you can do, and you can gauge that with your own chronological age to your telomere age, and that gives us an idea of how, I guess, how much you burned the candle at both ends and how your body's doing. So I think it's an interesting test to look at that, plus maybe the genetic information, plus the nutrient status. And of course I do that after a whole visit to say, what's your gut, what's your hormone, what are your hormones doing, what's your thyroid doing, that whole picture, because again, that's that foundation.
It seems like we are entering into an era that allows us to look at this big picture more clearly than ever before. And rather than just assuming, you know, oh, you have that, so you have this disease, and ending it there, we can look at a picture. For example, you had brought up the high blood pressure. I just wrote a blog on that today, that we talked about 2 things that cause high blood pressure, which are eating processed foods and with a lot of sugar and a lot of trans fats. Those 2 things right there cause a lot of the high blood pressure. And as you were saying, those deplete nutrients. So you can look at, okay, we can replace the nutrients here, and that helps for now. That'll increase your lifespan, maybe, your quality of life. But in order to keep it that way, or instead of having to do all these things, we can change some lifestyle activities. So there are a wonderful array of things that people can go. And I know from knowing you and your patients that you give people choices. You know, what are you comfortable with changing? How far do you want to go with this? And that gives people control, which I think is huge. And if we know we're responsible for our health, we're more likely to take it.
And it empowers them.
It empowers them.
I can do something. I think that is the most powerful thing. And the other thing that I wanted to mention is that, again, that micronutrient panel, it's the last 4 to 6 months. So it takes you 4 to 6 months of having a healthy diet for it to get into the cellular level. So we're living this really instant gratification world where if it doesn't happen pretty quickly, we're out of here. And so we've got to stick with something for 4 to 6 months to be able to see it in that deep level, that cellular level, to see the effects.
That's absolutely, cells have to die and get replaced, and then you can start to see those changes. And you're right, even we do some of the same tests with glucose, and there's some of those that will change over a period of 3 months, but only because the cells have to die off and get replaced, so you can get an accurate reading on that. And I think we all understand that there is a time that the body needs to make those changes, and we're tuned into a lot of times just how we feel, but how we function is a huge part of the educational process, and I think for all of us who want to be more informed, you know, that should be the questions that they're asking. How can I function better?
Right.
That will lead to feeling better. We can trust that.
Right.
So let's talk a little bit more about some personalized medicine. So, you know, maybe some examples, some people that you've seen. We've talked a little bit about high blood pressure. What are some common things that people see you for, and how do you approach those, different than what we would see perhaps in an allopathic model?
Right. So I had a patient with low thyroid.
Low
right?
thyroid,
Healthy, happy, was monitoring her thyroid with more bioidentical hormones.
Did she know she had a low thyroid? Or
Yes,
okay.
yes. She was taking the thyroid support, the thyroid hormones, and doing pretty well, right? Managing the thyroid. After we learned this genetic and we got the genetic information back, I was able to see where the deficiency was, could pair that with a nutrient panel, give her the more specific nutrients, and within a few months she was off her thyroid meds, only because she started having high thyroid symptoms, right?
Yes.
High thyroid symptoms, decreased her dose, kept going, had to decrease it more, and pretty soon she was off. And after being on thyroid for 6 years. So to me, that is pretty. I haven't been able to really do that. I mean, a lot of times you know when you're on thyroid meds, you have to stay on thyroid meds. But for this, I mean, you need those nutrients to be able to make thyroid hormone and convert it and get it into the cell for cellular function. So thyroid is a much more in-depth imbalance than just looking at TSH or free T3 and free T4. You got to look at all of it plus the nutrients. So once her nutrients were repleted appropriately, she didn't need the thyroid meds and is feeling better, more energy, is just getting more out of life. Yeah. So we just took it up that notch. Even though she was pretty high, pretty functioning and felt good, we were still managing it with hormones. After we did that, she bumped up and she's not on it.
So you were helping her rebuild the foundation, which then made it unnecessary to treat the symptoms that were on the top. I am aware that so many people go to the physician feeling tired, and that may be their presenting complaint, or maybe they're overweight, they want to lose some weight, and the thyroid is the first to be blamed. Right. And I've read a lot of papers that suggest that perhaps the thyroid is not to be blamed, but it is merely reacting appropriately to imbalances that are occurring because of prolonged stress, prolonged deficiencies, prolonged toxicities, and I agree with you. There is tremendous amount of help that can be made without resorting to the drugs. I think that's the easy way out, but certainly, you know, with you know, all the symptoms that people present with, you know, you want to help them right away. Right. And so that's the trade-off. Okay, well, this is the right now, but at the same time, you can help them rebuild the foundation that makes it unnecessary for them to continue with that. We've got a few minutes left. We should talk a little bit about some other things. Do you have any other cases that are top of your head right now that are exciting to talk about? Digestion, you mentioned digestion. Is that a big problem?
I mean, digestion is huge because, you know, that is where you absorb your nutrients. That is like the roots of a tree, and you can't go fix the leaf if the roots aren't absorbing nutrients. So when you have what we call a leaky gut, that you can get that inflammation in the gut. You can have normal sounding bowel movements. You know, your bowel movements 1 to 3 a day, easy formed. But you can have normal sounding bowel movements and still have inflammation in your gut, which then sets the stage for arthritis, headaches, fatigue, and so there's allergies, right, food sensitivities, food allergies, and so it's really not about just taking those food allergies away. It's about healing the gut, and the gut you can have inflammation from the gut from having low vitamin D, other imbalanced hormones. I mean, we test hormones because I want to know the ratio of estrogen to progesterone, because if you don't know that ratio, that's causing inflammation. And most people that I see have that imbalanced hormones. And you know, so, and if you're low thyroid, you know you're low adrenals, because those two are two peas in a pod. You have one and you have the other, and they support each other. So it is all of that. I think that's why it's so multifactorial, is because we're such an interrelated, interconnected system that you can't just look at one thing, because that one thing affects everything. To the point that thyroid affects your serotonin. Serotonin causes you to have anxiety. Anxiety can cause the stress in your gut. Gut can cause, and it's just this vicious
sugar metabolism,
cycle.
the adrenals.
Right. And so sometimes, we have to go, okay, here's some adrenal support and thyroid support and hormone support, and we get people better, but then we can kind of like pull them out of the mud, clean them off, and then their body can start moving, and we can start pulling away the support.
Yeah, it's certainly a lot of times, as you say, it's almost like a circle with a lot of dots on it. And at some point you started this circle, and those are this circle of symptoms that a lot of people present with. And rather than trying to treat each dot, you may have to support them, but it's oftentimes really, that's why all these tests are valuable, because you can take a lot of time, expense, and trouble out of that equation by finding out where things may have started. And I think you're right. The gut plays a huge role. We've really done so much to destroy the natural way that we should be eating, that our bodies are doing the best it can, I know, to catch up and to try to manifest health. But if we don't give it the right nutrients, if we don't pay attention to what we put in, we're doomed to the symptoms that we get. So we've got a couple minutes left, so if you have some suggestions about how people might, since many people may not know what a naturopath does, how would they come to you? Do they have to get their physician to refer to you? Can they call you?
You can call us straight away, and if you have any questions, we do a 10-minute meet and greet, so you can come in, meet us. Many people don't know what a naturopath doctor does, and that we are licensed as primary care doctors here in the state of California. They don't realize we have that level of training, so we can really look at you from a medical point of view, but also this holistic point of view, and we are the specialist to get you back to optimal health. So you call our office, you can come do that, or you can come in for a free or for a 90-minute visit, and with that we look at it takes me 90 minutes to go over all the organ systems, the stress, to really get that big picture, and then decide what are the tests we're running. You know, what is the foundational piece? Because it's so amazing that I get these tests that to confirm my diagnosis. Like, look, you might have this disease, but this is probably why. Nutrient imbalance, hormones, adrenals, thyroid, and neurotransmitters, and so we can put it all together. And it's so empowering, because people then go, I can get better. And
well,
I'm
you
like,
simplify the process for them by helping get down to the meat of it. Do you have a website or any place that people can get a hold of you?
We have AuburnNaturopathicMedicine.com.
AuburnNaturopathicMedicine.com. Okay. And they can contact you there, or call?
Or call 530-885-5908.
And that's Bukovina.
That's Auburn Naturopathic Medicine.
Auburn Naturopathic Medicine. Thank you.
Auburn Naturopathic Medicine, yes.
Well, we're going to wrap it up today, but I want to say I really appreciate Miss Heidi Hook for coming down and sharing some great information with us. So thank you very much, and I hope you'll feel free to call on their office to ask your questions and to try to get yourself healthier. Thank you again.
Thank you. Thank you very much.
You're very welcome.